how you are going to answer the research question. So answering the research question is by conducting studies. So there are different types of study designs, and one has to choose an appropriate study design. So today, our session is on study designs. We have with us our expert faculty, Professor Dr. Mini SS. She is a professor of community medicine, Government Medical College, Trivandrum. She has dual degree. That is, she has a degree in otorhinolaryngology and has an MD degree in community medicine. Before joining Government Medical College Trivandrum, she was the head of the department of Government Medical College Thrissur during the COVID-19 pandemic, and she has played an active role in controlling the COVID-19 pandemic at Thrissur. She has a number of publications to her credit, and she is a member of the ethics committee. So I invite Professor Dr. Mini SS to our research methodology session. Welcome, Dr. Mini.
Okay, thank you, Sabina, for the nice introduction.
Okay.
And one thing you forgot to mention, we are classmates too.
Yes, yes.
Okay, thank you, Sabina. Shall I share the screen?
You may share the screen.
Okay. Is it visible now? No.
No, it's not visible.
But okay. Now is it visible?
Yes,
Okay.
Yes, it is visible.
Okay, thank you. Okay. Shall we start?
Yes,
okay.
we can.
Yes, we can. For some time I put a video also. Okay. So anyway, thank you, Sabina, for the nice introduction and also giving me this opportunity to deal with the study designs to the faculty and the PG students of the Department of Dermatology. So, it's not moving now. Okay, there was some problem with the slide share. Okay. So there was some problem with the slideshow. When I put it in the slideshow mode, it is not moving. So anyway, I am starting like this. So So why we do research? Anyway, I think you have, some of you may have selected your, am I audible now? Is it audible?
Yeah.
Yeah, okay. So, to any doubt, you can stop me at anywhere and you can ask doubt, no problem. So in medical research, so we usually do research in any of these things to know, either to know the burden of illness or the magnitude, to know the disease, why these diseases are occurring, that is causation, etiology, risk factors, or the what are the prognostic factors of this disease, or to know the efficacy or effectiveness of an intervention, or the efficiency of some interventions, or to evaluate or to monitor the effect of some program. So usually we do research on any of this to know any one of these things. So we call it as iterative loop, and all the majority of the medical research is on these topics. So for all to know all these things, we have to take a different design. That's what I want to mention. So about the design. So the study design, so it is very important because the design, it is that determines your what's that your data, how you have to collect the data, how you have to analyze, and how you have to interpret the result, and also how you have to calculate the sample size. Everything that depends on your study design. And the actually other one important thing is your objective determines the study design. That is also very important. So study design, it is very important. In methodology, the first thing you have to specify, it is the study design, then setting population, sample size, and how you are going to do the sampling, and what are the tools and techniques you are used to collect the data, and what are the data collection methods you are adopting, like that. So what is study design? So by definition, a study design is a specific plan for conducting the study. So actually it is a blueprint for action. It's a plan for conducting the study, which allows the investigator to translate the conceptual hypothesis into an operational one. So I have already said, based on the design. So till that are the hypothesis or the research question or the objectives, it is a concept. So based on the design, actually you are making that concept into an operational one. That was I have already mentioned, how you are collecting the data, how you have to interpret the data, how to analyze. Everything depends upon that design. That is why that the investigator, that it translate that the concept into operational. That is the importance of study design. So next, how to select the study design. It actually depends on your research question. So research question and hypothesis. So there is some difference between research question, hypothesis, and the objective. Research question, actually it is in the research that in the question mode. Actually, a specific version of this research question is the hypothesis. Korchudi refined down hypothesis. Hypothesis actually that in hypothesis, and who is the sample, what is your exposure variable, what is the outcome variable, everything you are defining in that hypothesis, and then you are changing that hypothesis into a fact one. Actually, a fact, it is your that is your objective. So based on the research question and your hypothesis, you have to select the study design, and based on the study design, so is it a descriptive, analytical, you have to do the analysis also. That's important. That is how you have to select a study design. So again, the selection of the study design in epidemiology depends upon, I have already said, it is based on the research question and the hypothesis, and also based on the resource and time available for the study. So anyway, the PG curriculum, according to the curriculum, the period is 3 years. You have to submit your thesis within the 5 years. Otherwise also, for other resources may be limited. So based on that, You can't have a cohort study or an intervention study that will take around 4 years to get a result. We can't select something like that, some design like that. So it also depends upon the time available and also resources available, and also the type of outcome of interest. So you can't wait for an outcome after 4 years like that, and also the exposure and also ethics. For all the research involving the human subject, we have to have the ethics committee clearance and all. So the design you are selecting, it also depends on the ethics. And ideal design is, so for some research questions, then ideal design not always possible, but you have to select the strongest appropriate study design. So based on all these things, you have to select the design. Then what are the types of epidemiological studies we are having? So based on this, actually, based on these studies, we are having the designs also. So these are the epidemiological studies usually we are doing. One is, all these things you may be knowing. We are having the observational studies and the experimental studies. Observational studies means we are just observing what is happening in the population or what is happening in the for that individual like that. So we are not doing any intervention. But experimental studies, we are doing some manipulations or some interventions, and we are looking for the results. And again, observational studies can be two types. It can be a population-based study or an individual-based study. The unit of studies either can be a population or can be an individual. Or if the unit of study is population, again, it is two types. It is descriptive and analytical. Descriptive means only then population-based descriptive study. We are describing that disease or some event. So you may be remembering the definition of epidemiology: disease, event, health-related state, something like that, all these. So that event means either can be death, relapse, or anything, disease or health-related state. It can be NCD or a nutritional problem like that. You are describing that problem in relation to time, place, and person. But a population based on one analytical study is also there, that we call it as ecological studies. I'm having a slide on that. There I will explain about the ecological study. Then coming to the observational studies, that is individual-based studies, that we are starting with the case report or case series, and then we are having the analytical studies. We are we are looking for the determinants. And one important thing from the observational studies, we are making only some hypothesis to generate a hypothesis. But in the analytical studies, we are doing testing of that hypothesis also. So analytical studies, there are again three types: cross-sectional, cohort, and case control. Usually in some textbook, only cohort and case control has been mentioned, even in PARC also. But in cross-sectional study, so now it is in some textbook, it is also included in analytical, because at a point of time, we are looking for the cases and those who are having the outcome and not having the outcome, and we are comparing that two groups. Some in observational studies also, in a point of time, we are doing that. So that's also a part of analytical study. Then coming to the experimental studies, I have already we are having the RCTs and non-RCT. There are so many types of non-RCT or quasi-experimental, because in some conditions, we can't have all the elements of RCT, randomization. It is not possible. Sometimes it may not be ethical. So in such situations, we usually choose a non-randomized control trials. So these are the epidemiological studies usually we are doing. And based on this, we are having the designs also. So the two types of important designs are the observational studies and the experimental design. Under observation, we are having the descriptive studies and analytical studies. And under descriptive study, we are having case report, case series, cross-sectional studies. Can be either two cross-sectional and longitudinal survey. These two comes usually under surveys, that is cross-sectional and longitudinal. Analytical studies, case control, cohort, and cross-sectional. Experimental studies, RCTs and non-RCTs. So these are the important designs we are having, but we are also having some other designs, but that also usually we accept it as standard designs. One is diagnostic test evaluation. You want to evaluate a diagnostic test as against a screening test against a gold standard test. So that you can, if you are doing that, you can definitely write it as a diagnostic design as a diagnostic test evaluation. And in some paper or some thesis, they are putting it as descriptive studies. That's also okay. But diagnostic test evaluation, it is an accepted design. And another important thing is qualitative studies. Qualitative studies also is an important design to know why it is occurring. You can have qualitative studies. There are so many methods to do qualitative studies, in-depth interview, focus group discussion. There are so many qualitative techniques. And some one other important, it is mixed method. There we can combine both the qualitative and quantitative. I have that actually I have mentioned on all the quantitative study designs. Along with that study designs, we can combine some qualitative for a subgroup. For example, if you are studying on very special skin disease and you want to know why it is occurring, you want to have some behavioral component related with that disease, you can have a qualitative component along with by interviewing some of the patients. Okay, like that. So that we call it as mixed method. Coming to the descriptive studies. So that the descriptive studies, actually it is the first phase of an epidemiological investigation. Okay, we are starting so to have a hypothesis, we are starting with the first phase of epidemiological investigation, and we are observing the distribution of the disease or health related state or even in that particular population. The first phase of epidemiological investigation, observing, we are just observing or describing that disease or that event and identifying the characteristics of the disease or event, and we are describing the disease in terms of either in the clinical data. Usually our majority of the theses are hospital-based descriptive studies, and we discuss what, when, where, who are affected, what are the characters of the disease, is there any special character or any other special biochemical parameter is related with that disease, something like that. Then coming to what are the different types of descriptive studies. It can be case reports, case series, ecological studies, and surveys. So these are the important descriptive studies we are having. That is case report, case series. 1 minute, I will come just now. Isha. Okay, so these are the important descriptive studies we are having. That is case report, case series, ecological studies, and the surveys, that population based or some, even it can be hospital based, it is cross-sectional and longitudinal studies. And what are case reports? Case reports, you may be well aware of the case reports, that a special detailed report by one or more clinicians on the profile of a single patient. So a rare disease or a rare event, we are describing that this is as a case report. Describe the experience of a single case or a group of patients with a similar diagnosis. Collection of individual case reports occurring with a fairly short period of time. The advantage of case reports is that it is the time it is very important. That is, you are having a good case report. So you may be remembering the COVID, that initial cases during 2019. So actually they have came out with that case reports of a special kind of pneumonia from China, and they later find out that that disease is caused by a special a different type of that coronavirus, that was COVID-19. And one other important things, and actually some few new disease have been discovered or identified by through this case series. So the important thing is, I have already said COVID-19, that this also, the pneumocystis carinii pneumonia. Actually, they observed a special kind of pneumonia among those men, those who are homosexual and immunocompromised. And why they are having this special kind of pneumonia? So actually, that investigation looked back to that identification of the disease AIDS. That's the importance of case series. Actually, it is the first part of an epidemiological investigation. And another disease, actually, I have copied from a journal. The first, and I think Sabina has also mentioned that at the first COVID-19 patient was admitted in Thrissur Medical College. That at that time I was heading the Department of Community Medicine in Thrissur. Actually, we did a lot of work, the first patient, and we referred so many documents to set up the ICU and defining that case definition, everything. So we published that first confirmed COVID-19 infection, even as a case report, and how we have tackled, how we have did the RT-PCR. I think the third sample came as negative. So that's the importance, to show the importance of that the case report. Next comes the case series studies. So instead of a single case or a few cases, in case series studies, we are having a series of cases, a group of patients with a similar diagnosis under the same procedure or the same character is studied. And the size of the case series can be either from 2 or 3 cases, even to the 100 or even 2,000. So you may, we are having even from COVID-19, even 3,000, first 3,000 case studies or the clinical features and all. And we have got the incubation period from that case series study, like that. That's the importance. And also an important example in the history, it is the thalidomide and the use and congenital anomaly. Actually, McBride noticed that the limb abnormalities among a series of cases, those who have used that thalidomide, and from that, so that's another example. But case reports and case series having some limitations, that is no appropriate comparison group. There is no, only the numerator we know. What's the denominator among whom it is occurring? We are not, it is having a comparison group or a denominator. And we can't use any test for validated statistical or no test, nothing. And it is not based on a true study design also. So case series and case reports we consider as primitive or the primary studies, and it is not a true epidemiological study designs, and it is not considered as even a true research article also. Even though you have published this, it is not considered as a true research article. That's the disadvantage. So that coming to the cross-sectional studies, and it is the cross-sectional studies. There are 2 types. I have already said it is either it comes under the observational studies, either cross-sectional and longitudinal. So it's a type of observational study. You are just describing the disease in terms of time, place, and person. And actually, the cross-sectional studies we are used to generate the hypothesis. Is there a causal factor? This can be a causal factor like that only. But we can't prove or that the causation. So the important steps in the case cross-sectional study, that anyway, you have to define the target population. So in if you are doing it is a cross-sectional hospital-based cross-sectional study also, the same steps are being followed. You have to define who is your study population. In many of the thesis, there is a when we ask when they are submitting this to the ethical committee, we say who is your study population. Then also people are having some difficulty. Who is the target population? Who is the study population? First, define your study population. Who is exactly is the study population, and how you are taking. You can have to calculate the sample size. How you are take the samples. Samples means how you are recruiting the patients to your study, and have to have an operational case definition, either to identify the target population or even to identify some character in that study population. And you have to, based on that, you have to estimate the outcome. And the outcome we are comparing with the non-indices or with the non-indices or that with the non-parameters. We are comparing it with the incidents in some other hospital, incidents within other state or something like that. And based on that, we are formulating an etiological hypothesis. So these are the usual steps in case control study. Cross-sectional study. So it is that descriptive study, it is just like taking a snapshot. You are describing that disease or that particular character among some people only for that period only. It is valid for the time period is that only. It is something like taking a photograph. One-time measurement conducted on a sample derived from a population. So from that what you are deriving it from a descriptive study, it is either the prevalence. In the community, you will get the prevalence, but in the hospital, you will get a proportion of a particular character to describe the disease spectrum. So that the prevalence in the community setup, the prevalence we are calculating that at the point of time, we call it as the point prevalence. For example, so this is the study done in by our former HOD Vijay Umar sir. High prevalence of type 2 diabetes mellitus and other metabolic disorders in rural central Kerala. So they estimated the prevalence of type 2 diabetes, and in the results also you can have, I'm not reading the results now. So they estimated the prevalence, so that it is an example of a descriptive study. Then the cross-sectional study, so it is having some limitations also. So we are taking only existing cases rather than the incident. We are taking all the old and new cases. So sometimes there may be some difference between the existing and the new cases, because the factors associated with the survival. If some people died before with that disease, before we are conducting that survey, we can't get that people into our study. So that's one limitation. And the temporal sequence between the exposure and disease cannot be established. So these are the two limitations of the cross-sectional study, but it is an important study we usually used, and we are doing it in either in the population setup or in the hospital to describe the disease in terms of place, person, and magnitude, and also to describe some certain specific or particular characters. Then coming to the longitudinal surveys. Longitudinal survey, again, it is a part of it is a type of observational study. A group of subjects under surveillance over a period of time. So we are looking at a group of people for a period of time, longitudinal. We are doing follow. Longitudinal survey of a single group of people at risk of developing a particular outcome. So we are taking a particular group, of people, and we are looking them for the development of a new disease or so anyway, it is the new case, remission, relapse, or for a specified duration. So since it is longitudinal, we call it as prospective studies, because when a particular point of time we are doing the follow-up. So even for is it prospective observational studies, you can put it like that, prospective observational studies, no problem. And prospective comparative studies, if you are having two groups, you can put it as prospective comparative studies also. And here the period of longitudinal, because we are doing follow for a particular period, the denominator is the product of that. Usually we put the denominator in person years. For epidemiological studies, it is person years. But in hospital studies, even you can put it as proportions, no problem. But there is some difference between the longitudinal studies and cohort studies. So, why can't put it as a cohort study, prospective cohort? Prospective cohort, if a word meaning cohort means a group of people, I agree with that. But when it comes to the design, cohort means always you will be having a comparative group also. But here we are not having a comparative group. We are having only one group. So we can't, putting that word as a cohort, it is having some artham, which there is it is different. So for longitudinal angle, you can put it as a better word is prospective observational study. Then example is leprosy incidence. A 6-year follow-up of a population cohort in Bangladesh. In this, it is they have put it as cohort because they are having a large group of people with different kinds of exposure. But usually in longitudinal, we won't have in hospital, especially hospital longitudinal studies, we won't have different grades of exposure. Sometimes you may be doing with the patient, same kind of patient. So it is better to put it as a prospective study. Then another important study under descriptive, it is ecological studies. So here it is the population as the unit of study, group of unit of study is population. So here we are not taking any individual level information. We are considering the population as a whole, and we are making inferences also based for that population. So for example, if a skin disease, it is peculiar in particularly affecting a population in a particular place. You are doing an investigation and you are comparing that population with some other population which is having not such disease or no such exposure. So it is an ecological study. So their results will be for that population only. You can never have that results for some other population, or that is not for the individual level also. Example of an ecological study, it is effect of fluorine in drinking water on birth weight and an ecological study. So they have, it is made, so what is the effect of that birth weight? They have compared with some other place. Okay. So these are this slide I have put just to mention a few terms and when to use these terms. Don't read the first sentence of this slide. Actually, I have put it this before the cross-section. I am starting the cross-sectional study slides. So when we can put these terms, retrospective, prospective, and cross-sectional. So retrospective, always you can use that word when you are collecting some data. Already it is there in the records, a retrospective study. Already data is there. You are collecting that data and you are analyzing. You can put it as a retrospective, no problem. And the prospective means you are recruiting the people and you are looking forward for collecting that data. For a particular period, you are looking forward that patients to get that data. You can put it as a prospective study. And you are only looking that taking data or examining that patient only once or one time, that it is a cross-sectional work. That is about the descriptive study. And what are the analysis we usually do along with the descriptive study? It is descriptive analysis, what we are usually doing. If it is the categorical data, we can put our results in percentages. And if it is continuous data, we can put it in terms of mean and standard deviation, and along with confidence interval. We will always express our results with two standard deviation, and whether that any significant association between those parameters in the categorical variable, we usually do a chi-square test, and with a 95% confidence interval, we consider a p less than 0.5. And for continuous data, we usually do a t-test. So that is about the descriptive studies. Coming to the other group, that is analytical studies. We are having the two main important analytical studies are cohort study and case control study. എന്തായാലും മിണ്ടാതിരിക്കുന്ന ഇതുവരെ ഉള്ളതിൽ എന്തെങ്കിലും ചോദിക്കും. എല്ലാവർക്കും മലയാളം ഒക്കെ അറിയുന്ന ആൾക്കാരല്ലേ? സബീന?
Yes, PGs, student, PGs and other faculty members, if you have
any doubts,
you can ask.
Yeah, regarding any descriptive design or longitudinal case series or anything, you can ask. Now I am moving to the analytical studies, cohort and case control.
Can I ask one question?
Yes.
The thing about Dr. Mini, you mentioned about cross-sectional studies.
Yes.
And you said you can use the term retrospective if you are analyzing collected data from collection.
Yes.
So, can you combine the term retrospective cross-sectional study?
Yeah, retrospective cross-sectional. So, hospital-based retrospective study means cross-sectional എന്ന് പറയണമെന്ന് നിർബന്ധമൊന്നുമില്ല. Retrospective study എന്ന് പറഞ്ഞാലും മതി. Retrospective cross-sectional also you can use, no problem.
We are seeing these terms in many PG theses. Prospective cross-sectional, prospective study, retrospective cross-sectional study, we see these terms. And also cross-sectional analytical is one term we usually see, and cross-sectional
yes, now it is now in recent textbook is cross-sectional analytical study. It is an accepted design, no problem. Cross-sectional analytical is accepted in recent textbooks. It is no problem. A hospital-based retrospective study means it is cross-sectional only. Retrospectively, you are collecting data and you are analyzing, and you are telling your results are based on either proportion or mean. So hospital-based retrospective study, no problem. You can put it like that. Hospital-based prospective study also. Hospital-based prospective study means you have to have prospectively you are recruiting patients, and prospectively you are seeing patients also. Prospectively, there is one or two measures or consultation with the patient. Then only you can put it as hospital-based prospective study.
For example, if we are giving the patient a treatment,
yes,
and we are following up after some months. For example, in psoriasis, you're giving a drug, and after 3 months, you're observing to see whether there is a reduction in the psoriatic area severity index. What do you call it?
Hospital-based prospective study. Or hospital-based longitudinal study, because you are having longitudinal study, because you are having only one group. You are not having a comparison group. You are longitudinally doing follow-up for a group of people. So it is a hospital-based prospective study.
Sometimes what the PGs do is they compare two groups. Suppose for psoriasis, one patient is being given methotrexate.
Then prospective. Prospective comparative study. They can define these two groups. Prospective comparative study. They can define two groups. No problem.
Okay. Thank you.
Okay, so anybody else want to ask anything? Okay, I will move on to cohort, and actually I didn't put any steps in cohort study, case control study like that. So cohort means that as the word meaning, it is prospective only. Prospective begins with an exposure, and we are doing the follow-up, and we are looking for the outcome in the people. Case control, we are starting with the cases and controls, and we are looking back that retrospectively for the exposure among these people. Okay, so case control study. So you can see in the picture. So that we are starting with the population with outcome cases, population without outcome as controls. So cases, controls, and from these cases and controls, we are taking the samples, because sometimes there may be so many cases. So we are recruiting a sample of cases and a sample of controls. How we can select the controls? Is it either age match, group match? There are so many criteria to select the controls. I'm not going to the details of that. And so the cases means with the outcome. The controls means they are not having the outcome. In both groups, we are looking for the exposure for a particular factor, or it can be either a drug, or it can be a radiation, or it can be any other, some behavioral factor or anything. So the basic framework of the analysis of, I'm not going for the steps and also the of case control study, that steps in to the selection of cases, selection of controls, and how the matching and the measurement of exposure analysis like that. So the cases can be defined either by a clinical criteria or a biochemical criteria that you may or may be knowing. So the analysis of case control study, it is by drawing the basic 2x2 table. It is also called a two-way frequency table, because it is having 2 rows and 2 columns. Two-way frequency table. It is the 2x2 table. It is the basic framework for so many analysis. So in case control studies, we are starting with cases, that is A plus C, and the controls B plus D, and we are looking for the exposure among these cases and controls. So the outcome measure or the effect measure in case control study, it is, you all know, it is the odds ratio. Odds ratio. So in the here we have taken the type 1 diabetes cases are the patients as cases, and normal people as controls, and the exposure factor we studied in this example, it is the HLA-DR4, and for that the presence of that gene, we look that for that exposure, and we have put the results in the 2x2 table. We have taken etra case, etra control ഉണ്ട് ആരെങ്കിലും നോക്കിയിട്ടൊന്ന് പറഞ്ഞു. ആരും കേൾക്കുന്നില്ല. So 37 cases and 37 controls. And the odds ratio we got, it was 3.6. And very important thing, so how you know how good is your odds? How good is the odds you derived from your study? So it is by 2 things. One is by taking the 95% confidence interval. So there is formula for that also. From SPSS also you will get that. So if you are deriving the 95% confidence interval also, the odds ratios should have a value more than 1. Then only it is relevant or having significance. Significant relevance. Here in 95% confidence interval 1.3 to 10.4. So it is a good odds. And the other is, it is that odds means the strength of association. So whether this strength of association is statistically significant or not, we are deriving it by doing the statistical test, that is chi-square. Chi-square also, the P is less than 0.5. So it is a significant relation. That is how you are deriving, or you know, so you are knowing how good is your odds and whether this strength of association is significant or not. That is about the case control study. Case control study is a simple design. We are taking with the cases and controls, and we are looking back. It is for the exposure. That is why it is called retrospective study. We are putting, and the basic framework of analysis is the 2:2 table. We are usually the outcome of measure is the odds ratio, and how good is your odds, it is you are looking like. And the cohort studies, you maybe you all know, we are starting with the population, that is the people having an exposure and not having the exposure. We are doing follow-up of these two groups for the development of the disease. So for the development of the disease or no disease. So among exposed and not exposed, what is the rate of the disease? Rate of disease means what is the rate of that particular outcome. So it may not be disease always. So what is the outcome in these two groups? So the basic framework, it is like this. It is again 2:2 table, but here for the 2:2 table for cohort study, it is we are having a little difference. That is, in cohort study, we are starting with A plus B and C plus D. That is exposed and non-exposed. But in case control study, we are starting with A plus C and B plus D. That's the main difference. So here we are starting with the exposed and non-exposed. And after a period of time, among exposed, how many has developed the disease? And among the non-exposed, how many develop the disease? So, but again, according to the time of starting of the cohort study, there we are having three types of cohort study. That is the true prospective cohort study, retrospective study, or ambidirectional study. So what it is? So the prospective study means that it is the exposed. We are starting now. We are starting with the exposed and non-exposed, and we are looking for the outcome, a concurrent study. So it is going forward, and we are looking for the outcome. But what is a retrospective cohort study? A retrospective cohort study means we are retrospectively identifying the cohorts, or those who are having the exposure and those who are not having the exposure. Retrospectively identifying, and we are looking for the outcome in the. So what is the outcome in that people at the point of time? That is a retrospective cohort study. But ambidirectional, we are identifying the cohort from the records, and we are looking for the outcome at the point of time. And also we are doing a follow further for looking for the further outcomes also. That is ambidirectional. We are not only looking for the outcome at the point of time, but we are doing a follow for further outcomes. So if we are doing an analysis at the point of time with the cases and controls, by taking the already occurred cases and controls, we call it a nested case control study. Sometimes in some journals and all, it may be, you may see a nested case control study. Nested case control study means cases and controls nested in a cohort. That is at the point of time, you are taking a few cases that's already occurred and the controls, and you are doing some analysis. But one important thing is that there is a chance of all the cases to become controls after a period of time. That's the question. So that is nested case control study. And what are the outcomes we will get from a cohort study? You may be knowing. So because we are doing the follow-up, we will get incidence of cases among exposed. That's a true incidence. And also incidence among unexposed. What is the incidence among those who are not having that exposure? And from these two, we are deriving the relative risk. And based on this relative risk, all the other risk measurements such as population attributable risk and the population attributable risk factor, like that. So in a cohort, sometimes maybe you can have the time to event analysis also. Some event that relapse, some time to. So it is also something, it is not related with, it is like risk ratio, but time to event analysis also based on based on this outcome study, survival analysis. That is about case control and cohort. And coming to the another important study design is the clinical trials or randomized control trials, that is RCT. Research studies aimed at evaluating a medical, surgical, or behavioral intervention. This we are not observing, we are doing some intervention or some manipulation in the participants, and we want to measure the effect of that intervention. So the year-old story, James Lind is the first man who did some clinical trial using, and I'm not going for the details. So the clinical trials, so you are taking a target or a study population, and the characteristics of the study population, you know, it is representative of the target population. You have to check the eligibility criteria and informed consent. So these three things, it is important for all other studies also. Your study population should representative of the target or that universe, and eligibility should be there, and informed consent has to be get. And from this study population, you are randomizing these into a treatment group and a control group. So random assignment. So randomization is the heart of RCT, because we are ensuring matching, equal distribution of confounders, everything, it is there. That is why it is considered as an important study design, randomization. And you are doing the intervention, and you are following you are doing the follow-up for the outcome. So based on the outcome, you are doing the analysis. That is RCT. So the analysis, again, the important analysis we are doing in the RCT, it is either intention to treat analysis or per protocol analysis. So we are intended to treat 500 people, but in an intervention arm, and in 500 people in control arm. But in treatment arm, we are having only 420, but in control arm, 470. Among this, the favorable outcome was for 400, but there it is 450. But according to the intention to treat, we will take both arms, we consider 500, it is intention to treat, and per protocol, and those who have completed the treatment, or those who with the that at the end of the study. That's the analysis we use. I'm not going to the details of that. Then, and I've already said, in some situations we can't have the real RCTs, randomization, it is not possible. In such situations, we will go for non-randomized trials. So without randomization, for example, before-after designs. For some same people, we are giving some interventions, and we are measuring the effect after the intervention. And also simultaneous non-randomized design. Simultaneous non-randomized design means two programs. One population is having one program. That for the whole population, the program intervention is there. Some other population, it is not there. So we have, in such situation, we can non-RCT, utilizers and not utilizers. Naturally, they belong to these two groups. There is no point in randomization, eligible and non-eligible like that. So non-RCT is also an important study design. Then another important design we usually we are using or we are doing, it is a test evaluation. That is diagnostic test evaluation. And I didn't put the two into table for that. Usually the measures of validity we are deriving from the test sensitivity, specificity, and positive predictive value and negative predictive value. And based on this, we can have the star ROC curves for the different cutoff, and like we can derive likelihood ratio, that so many other analysis also. That is about that design. Then that is that important other design we are usually, it is not as part of the thesis or we are doing. It is a meta-analysis. It is the analysis of analysis. There are so many studies done in many countries or many places. We will combine the results and to get a pooled measure on for a particular disease or something. So there are so many steps for doing a meta-analysis, how to select the article and how to derive the data and all. That is why we call it as meta-analysis. It is combining of different studies to get a pooled effect. Then study questions and appropriate. So the final slide, that is the, so usually, so based on our type of question, we select the design, as I have already mentioned in my first slide. So to know the burden, the prevalence and incidence, what is the burden of that particular disease in the community, we usually do cross-sectional survey and also some longitudinal survey to know the incidence. Then causation, risk and prognosis, we usually, what is the causative factor, determinants, we do an analytical study, can be either case control or cohort. And to the occupational risk and environmental risk, so who the population, is that population is truly having that risk, that we do an ecological study. And treatment, efficacy, diagnostic evaluation, cost effectiveness, everything, we go for a randomized control trial. And this is about the evidence pyramid. So if it put all these things in the reverse order, it become the evidence order. So the hierarchy of epidemiological study design. Anyway, we are doing research to derive the results, and based on the results, either we are making the hypothesis or we are proving that hypothesis, or we are deriving the evidence. So RCT, we are deriving the evidence. So based on this, so there are certain hierarchy based on this evidence, that hierarchy of the designs also. So case report, case series and ecological studies, they consider as primitive and they are used to generate the hypothesis. Cross-sectional studies, case control studies and cohort studies, actually we are getting the, again that we are using the, to prove the hypothesis. In randomized control trials, we are getting that evidence price. So these are the hierarchy of study designs. So thank you. Can ask any questions. These are about the different study designs and the outcome measures from that study designs, and we usually used in our for epidemiological studies, but there are certain hybrid designs also. I have already said mixed methods, nested case control study, like that. These are all hybrid designs. But certain terms also we used in now in thesis and other paper writing article, and so that have we already discussed in case control, in descriptive studies, prospective study. Prospective means already you are looking forward. Retrospective means you are already analyzing the data already there in the records. Like, okay, thank you. Any doubts? Roshni, I don't know. Oh, yeah. Sabina?
Yes. I'll ask. I think they don't have any doubts.
No.
I'll ask my doubts on behalf of PGs. One is that RCT, as you said, RCT is the best study design based on the hierarchy.
Okay.
Can our PGs do RCT?
Yeah, oh yes, RCT ചെയ്യുന്നതിന് കുഴപ്പമൊന്നുമില്ല. പക്ഷേ നമ്മൾ ഇപ്പോൾ 2017 ethical guidelines ആണ് we are following for doing medical research. Under that, നമുക്ക് അതിനകത്ത് RCT രജിസ്റ്റർ ചെയ്യുന്ന ഒരു സൈറ്റ് ഉണ്ട്. For they have to register in that site. എൻ്റെ പേര് ഞാനിപ്പോ അത്ര ഓർക്കണില്ല.
Clinical trial register. Yes.
Clinical trial, they have to register and they can do. But along with that guide, they have to register. All these are online process. Within 2 to 3 months, at least within 3 months, they will get that permission letter from there. They can do RCT.
So only those established drugs, no? The drugs we commonly use.
Yes.
No
drugs
new,
common.
No new drug trials.
No new drug trials. No.
Okay. And the The first investigator should be the primary investigator should be the guide. Is it like that? Guide. Okay.
I think so. I think so. Otherwise, you have to go to that site and see. So I didn't register in that. So the details what is there in the portal, I don't know. But there's a portal. Once you get through that portal, you apply for that. You register your RCT. After getting permission, you can start the RCT. No problem.
Only with the clinical trials registry, that number you can
start. Then only we will give the ethics clearance. Only with that. Clearance. Yeah.
Only then we can submit it to the institutional research committee. Is it like that?
No. You can get the approval from the research committee along with the IRC certificate. You apply for that through the portal for this, and after getting that number, registry number, you apply with that number. You apply to the ethical committee. Like that. Yeah.
Okay.
Only with
then yes. My next doubt is can they do case control study? Case control study, is it feasible for the postgraduates?
Yes, of course, possible. I think from the Trivandrum they have submitted 2 or 3 case control studies.
One doubt is suppose a patient with lichen planus, they are doing one thesis was like that. They are studying hypercholesterolemia in lichen planus. So they have a group of patients with lichen planus, another group without lichen planus, some other disease. They are checking for the cholesterol levels. Can you call this a case control study or a comparative study? What?
Actually, either they're using all the criteria, they are taking these cases and the controls using all the operational definition. It can be a case control. They can do it as a case control study, and they have to calculate the sample size also according to the odds ratio. If they are doing their sample size calculation using this proportion, and they are just taking only by that those who are having the lichen planus and not having, it will become a comparative study.
That means cross-sectional comparative study.
Cross-sectional comparative study. Yeah.
Okay. If they're using the proportion.
If they are calculating the sample size using odds, and they are definitely taking cases controls like that, they can. It is a case control study.
Okay. So the most feasible study for the postgraduates will be cross-sectional.
Prospective comparison, prospective comparison study, or they can do a cross-sectional comparison study. No problem. If they are seeing a patient only for once, it is a cross-sectional comparison study. If they are doing some follow-up 2 or 3 times, they are looking for the cholesterol level and doing that, it is then become a prospective comparative study. Yeah.
Okay. Okay. Any other doubts? So thank you. I think that they don't have any doubts. So thank you, Dr. Mini, for that clear, simple, and wonderful talk. Thank you very much.
Okay.
One announcement to the postgraduates. Our next session is on Tuesday, and there is a change in the topic. The topic will be on statistics instead of sampling and sampling techniques. Okay. So thank you, Dr. Mini.
Thank you, Sabina. Thank you.
Thank you all. Okay.